Hello, I'm Nikita Quarshie, one of the researchers at Centre for London, and I'm going to present some key data from our latest Snapshot of Londoners survey. This update delves into Londoners' outlook as the city emerges from the pandemic and our views on the places we live. 45% of Londoners are feeling optimistic about the employment prospects, more than at any time in the past year. But some groups are more optimistic than others, such as younger people, men, racialised Londoners, and people with a higher socio-economic status. The economic impact of COVID has set Londoners apart. 41% say the pandemic has shrunk their disposable income, whereas 20% have seen their disposable income increase. People who have taken a financial hit are more likely to be women, racialised Londoners, self-employed workers, and those with a lower socio-economic status. More Londoners are in a precarious financial position than in September 2020. 48% said they wouldn't be able to meet an unexpected expense of £500 from their own money, up from 44% in September. This increase is in part driven by greater financial precarity among women and racialised Londoners. More Londoners are satisfied with local amenities and public services than are dissatisfied with them. Differences between groups are most marked in the police service, with black Londoners much less satisfied than other groups. Satisfaction with public spaces is higher among older people and lower for parents with children under 18. Satisfaction with the provision of cycle lanes is higher in inner London. Overall, London is still the place to be for most Londoners, and this hasn't changed from last year. 65% of people are still happy to be living in London, and even more, 79% of people still expect to be living in the city in a year's time, leaving only 8% unlikely to, and 12% who aren't sure. 57% of Londoners are showing more optimism about their health since our last survey in January, as the vaccine rollout progresses. 15% of Londoners are still left feeling pessimistic, with disabled Londoners most likely to say so. Despite racial inequality in the COVID-19 mortality rates, racialised Londoners are more likely to be hopeful about their health in the next 12 months. Young people and Londoners with children under 18 are also more likely to feel positive about their health in the near future. 58% of Londoners are happy with the quality of healthcare in their area. For most groups, there was a peak in satisfaction with local healthcare services in May last year. However, satisfaction has since decreased, most quickly among racialised groups. As businesses reopen, nearly 2/3 feel comfortable about heading into central London, up from 43% in January and from 52% in September last year. Despite a vaccination rollout which prioritised older adults and health and care workers, young people are much more likely to feel comfortable than those aged over 55. Involving Londoners in the challenges facing their neighbourhoods will be an essential part of addressing them. However, only 30% of Londoners believe that they can influence decisions about their local area. Young people are almost 3 times more likely to agree than older people over the age of 55. Racialised Londoners, 39%, and people with children under 18, 37%, are also more likely to believe that they can have an impact in their local areas. If you want to find out more about what Londoners are thinking, be sure to check out the full update on our website, www.centreforlondon.org.